Every single day, millions of people around the world wake up and take a small pill called amlodipine to control their blood pressure and protect their hearts from serious cardiovascular disease. It's become one of the most commonly prescribed medications globally, trusted by doctors and patients alike to manage hypertension and prevent devastating events like heart attacks and strokes. But here's something that might genuinely shock you. That innocent glass of grapefruit juice on your breakfast table could be silently interfering with your medication. That herbal supplement you take for stress might be undermining your treatment. Even that over-the-counter pain reliever could be putting your kidneys at serious risk. Today, we're uncovering the hidden interactions with amlodipine that most people don't know about, but absolutely need to understand. The information you're about to receive isn't just medical trivia. This is practical knowledge that could literally prevent a medical emergency for you or someone you love. Every interaction we're discussing is thoroughly documented in peer-reviewed research and recognized by healthcare professionals worldwide. Yet these critical details aren't always clearly communicated during doctor visits. That changes right now. If you're new here, welcome. Before we dive into these crucial interactions, hit that subscribe button and turn on notifications. We'd love to connect with you, so drop a comment telling us where you're watching from. Your engagement helps us reach more people who need this vital information. Before we explore what can interfere with amlodipine, let's understand how this medication works, because this foundation will help you grasp why certain interactions matter so profoundly. Amlodipine belongs to a class called calcium channel blockers. Inside your body, calcium ions play a crucial role in muscle contraction. When calcium enters the smooth muscle cells lining your blood vessels, it triggers these cells to contract and tighten. When vessels constrict, the space for blood flow becomes restricted and blood pressure rises. Think of it like pushing water through a narrower pipe where pressure increases dramatically as diameter decreases. This is where amlodipine works its magic. The medication blocks the channels through which calcium enters these cells. When calcium can't get inside, muscles can't contract as forcefully. Your blood vessels relax and widen, creating more space for blood to flow easily. This reduces pressure against arterial walls, lowering blood pressure and making your heart's job easier. The medication also improves oxygen and blood supply to your heart muscle, which is why doctors prescribe it for high blood pressure, chest pain called angina, and other cardiovascular conditions. But here's the critical part. The way your body processes and eliminates amlodipine can be dramatically altered by other substances you consume. These can be prescription medications, over-the-counter drugs, foods, supplements, herbal remedies, or alcohol. When interactions occur, either amlodipine levels in your bloodstream increase significantly beyond what your doctor intended, leading to dangerously low blood pressure, severe side effects, dizziness, and fainting. Or the opposite happens, where levels decrease, making the medication ineffective and leaving you vulnerable to heart attacks and strokes. Let's start with one of the most common interactions affecting thousands daily. If you're taking amlodipine, there's a high probability your doctor also prescribed a cholesterol-lowering statin. This makes medical sense because managing both blood pressure and cholesterol are pillars of cardiovascular prevention. Statins have saved countless lives by lowering cholesterol and reducing heart attack risk. However, when simvastatin specifically combines with amlodipine, something concerning happens. Research published in multiple medical journals shows amlodipine significantly interferes with how your liver breaks down simvastatin. Both medications process through the same liver enzyme called CYP3A4. When taken together, amlodipine competes with simvastatin for these enzymes, meaning simvastatin breaks down much slower. Studies demonstrate this interaction can increase simvastatin exposure by up to 46%. This isn't minor. Elevated simvastatin levels dramatically increase your risk of muscle pain and weakness that can progress to rhabdomyolysis, where muscle tissue rapidly breaks down, releasing proteins into your bloodstream. These proteins can overwhelm your kidneys, causing damage or kidney failure, requiring dialysis. The UK government's Medicines and Healthcare Products Regulatory Agency officially states that when simvastatin is taken with amlodipine, the maximum simvastatin dose shouldn't exceed 20 milligrams daily, half the standard maximum. Your doctor might reduce your simvastatin dose, switch you to a different statin like rosuvastatin or atorvastatin that doesn't interact as strongly, or monitor you more carefully. Never make these changes yourself. If you experience unexplained muscle pain, tenderness, or weakness, especially with fever or dark urine, contact your doctor immediately. Moving to something unexpected, let's discuss an interaction that surprises almost everyone. Grapefruit juice, that healthy breakfast beverage packed with vitamin C, can interfere with amlodipine. This interaction has been extensively studied since its accidental discovery in the late 80s. Grapefruit contains compounds called furanocoumarins that powerfully affect the CYP3A4 enzyme in your intestines. This enzyme breaks down amlodipine before it enters your bloodstream. When you drink grapefruit juice, furanocoumarins inhibit this enzyme, and suddenly more amlodipine gets absorbed than intended. Research in the British Journal of Clinical Pharmacology documented that grapefruit juice can substantially increase amlodipine blood levels, potentially leading to excessive blood pressure lowering, increased dizziness, pronounced flushing, and severe headaches. Even a single 8-ounce glass can inhibit this enzyme for 24 hours or longer. You can't simply time your consumption to avoid problems. Studies showed grapefruit juice with amlodipine resulted in significantly higher drug concentrations compared to water. The safest approach is avoiding grapefruit and grapefruit juice entirely. Good news, other citrus fruits like oranges, tangerines, and lemons are perfectly safe.
If you develop a fungal infection while taking amlodipine, be extremely careful about which antifungal gets prescribed. Azole antifungals like ketoconazole and itraconazole are powerful enzyme inhibitors. Taking them with amlodipine without dosage adjustments can cause dramatically increased amlodipine levels, leading to dangerously low blood pressure, severe leg swelling, and cardiovascular complications requiring emergency care. Case reports document patients experiencing fainting and profound hypotension requiring hospitalization when these medications were combined. Ensure your doctor knows about your blood pressure medication before starting antifungals. Now let's discuss herbal supplements that many don't consider real medication. 3 specific herbs deserve careful attention if you're taking amlodipine. First is ginseng, or Panax ginseng, used for thousands of years to boost energy and immune function. However, research indicates ginseng can actually increase blood pressure in some individuals, directly counteracting amlodipine's effects. This creates a situation where you're working against your own treatment. Second is St. John's wort, known scientifically as Hypericum perforatum, extremely popular for depression and anxiety. This herb is a powerful inducer of liver enzymes, speeding up amlodipine metabolism. Research demonstrates St. John's wort significantly induces CYP3A4 activity, the enzyme responsible for metabolizing amlodipine. When taken regularly, it substantially reduces amlodipine blood levels by accelerating how quickly your body eliminates the medication. This interaction is so significant that many countries require warning labels on St. John's wort products. The result could be inadequate blood pressure control, leaving you at increased cardiovascular risk. Third is golden seal, or Hydrastis canadensis, valued for antimicrobial properties. Golden seal has the opposite effect, inhibiting liver enzymes and potentially increasing amlodipine levels unpredictably, enhancing both therapeutic effects and side effects. Given these substantial risks with all 3 commonly used herbs, discuss any herbal products with your doctor or pharmacist before combining them with amlodipine. Beyond medications and supplements, daily lifestyle choices significantly impact amlodipine. When drinking alcohol while taking amlodipine, you're combining 2 substances that both lower blood pressure and dilate blood vessels. Medical literature documents additive effects. Many patients report pronounced dizziness, lightheadedness, or fainting episodes.
There's also concern about orthostatic hypotension, where blood pressure drops suddenly when standing, causing falls, especially dangerous for older adults who risk serious injuries like hip fractures or head trauma. If you drink, extreme moderation is essential, and for some, complete avoidance is safest. Caffeine, found in coffee, tea, energy drinks, and chocolate, temporarily increases blood pressure through more forceful heart contractions and vessel constriction. For someone taking amlodipine to control blood pressure, excessive caffeine works against your medication. Most sources recommend keeping daily intake under 200 milligrams, about 1 to 2 cups of coffee. Individual sensitivity varies widely, so monitor your response. If blood pressure readings are higher than expected or you experience palpitations, reduce caffeine and discuss with your provider.
High-fat meals can also affect amlodipine. These meals may delay absorption from your digestive system, creating unpredictable variations in when medication reaches peak levels, potentially affecting blood pressure control consistency throughout the day. Over-the-counter pain relievers deserve special attention because they're used so commonly, yet many don't realize they interact with blood pressure medications. NSAIDs include ibuprofen, sold as Advil or Motrin, and naproxen, sold as Aleve. While effective for pain and inflammation, they can substantially reduce amlodipine's effectiveness. NSAIDs cause sodium and water retention, increasing blood volume and raising blood pressure. They also constrict blood vessels by affecting prostaglandins that help keep vessels relaxed, directly opposing amlodipine's mechanism. Research shows NSAIDs, particularly ibuprofen and piroxicam, can markedly blunt antihypertensive drug effects. Studies found ibuprofen significantly increased blood pressure in patients taking blood pressure medications. Furthermore, both amlodipine and NSAIDs affect kidney function differently, and combined, kidney problem risk increases substantially. Large analyses found significantly increased acute kidney injury risk when NSAIDs were combined with antihypertensive medications. For occasional pain relief, many providers recommend acetaminophen or Tylenol as a safer alternative because it doesn't affect blood pressure. If you need regular pain management, discuss alternatives with your provider. There's another food substance that deserves mention, and that's licorice. Products containing licorice, specifically glyceric acid, can cause high blood pressure as well as salt and water retention, which directly interferes with amlodipine's effects. Licorice can also decrease potassium levels in your body, and low potassium is particularly concerning for cardiovascular health and can increase the risk of heart rhythm abnormalities. For someone on amlodipine prescribed to protect heart health, this creates a contradictory situation. Licorice may be found in licorice-flavored chewing gum, candy, chewing tobacco, certain ethnic foods and beverages, and some herbal products. If you have high blood pressure, you should generally avoid or limit consumption of licorice products. One interaction requiring absolute emphasis is combining amlodipine with other calcium channel blockers like diltiazem or verapamil. This happens more often than you'd think when patients see different doctors unaware of all medications. Combining creates dangerous additive effects where blood pressure lowering and heart rate slowing intensify dramatically. This can lead to severe hypotension, with blood pressure dropping to dangerously low levels, causing profound dizziness, fainting, confusion, and in severe cases, shock. The combination can also cause bradycardia, an abnormally slow heart rate that's life-threatening. These medications also interfere with each other's metabolism through enzyme interactions, increasing blood levels beyond simple additive effects. Multiple case reports document serious adverse events, including hospitalizations from this dangerous combination. This is why maintaining an accurate, complete medication list shared with all providers is absolutely vital.
As we've explored these interactions, an important truth emerges. No medication exists in isolation. Amlodipine is an excellent, life-saving medication helping millions control blood pressure and protect cardiovascular health every day. It's effective and well-tolerated through decades of research. But like all medications, it requires informed, careful use. These interactions aren't meant to frighten you from necessary treatment. They empower you with knowledge for safe, effective medication use. Every interaction discussed is documented in peer-reviewed literature and represents real clinical concerns. If you're taking amlodipine and any substances discussed today, don't panic, and definitely don't stop anything abruptly without medical guidance. Suddenly stopping amlodipine can cause dangerous rebound high blood pressure. Instead, schedule a conversation with your doctor or pharmacist to review your complete medication list, including prescriptions, over-the-counter drugs, supplements, and herbal products. They can help determine if adjustments are needed, if alternatives might be better, or if certain combinations are acceptable with proper monitoring. The key takeaway is this: knowledge is power, but knowledge combined with professional medical guidance is optimal healthcare. Never change your medication regimen without consulting your provider. If you experience unusual symptoms while taking amlodipine, especially severe dizziness, fainting, excessive swelling, muscle pain, or concerning symptoms, contact your doctor immediately. These could be signs of medication interactions requiring prompt attention. If this video was helpful, kindly type yes in the comment. That motivates us to produce more content like this. Please hit that like button, share this video with anyone who takes amlodipine or blood pressure medications, and subscribe so you never miss important health information. Thank you for investing this time in your health education. Stay informed, stay safe, and remember that knowledge combined with professional medical guidance is the foundation of excellent healthcare. Until next time, this is your partner in health, signing off.